So we have the insurance companies telling us what they will pay for, what they won't pay for, what they won't authorize, what they will authorize. There are so many medications, such as even a generic medication, let's say for high blood pressure or diabetes. They deny it or they need a prior authorization, and this is considered first-line treatment, and you're telling me that we need a prior authorization for a first-line medication that is generic? That's
Right.
bullocks. That's absolutely nonsense. And then we have the insurance companies telling what they will pay for, what they won't pay for as far as like a hospital stay. So that might play into what insurances are accepted or not. That does put a barrier to access to care. The need for prior authorization or peer-to-peer references to say, hey, look, I'm the one that examined this patient. They need the MRI of X, Y, and Z, and you're telling me no. Can you tell me why? And you might not even be talking to a physician. If you are talking to a physician, they might not be of the same specialty. They might be of a specialty that hasn't touched a patient in several years. But they're
So
going by,
people are turning down MRIs, like if a physician will recommend them.
yes,
Why? For like insurance reasons?
insurance reasons.
What the hell is wrong with the states? Like these are things that I don't even understand. Like growing up in Canada, I spent most of my time, spent a lot of time in the last 10, 15 years in Europe. That is something that, like, the idea that a financially incentivized company can tell you no when a physician is granting you an MRI or recommends you get an MRI is absolutely fucking bonkers
Yeah,
to me.
yeah, it
Like,
is. Oh,
like,
yeah.
like the fact that that's happening and people aren't riding for that as well in the U.S. is also a mystery, because it's one thing that, like, there are other places that have two-tier healthcare, which I actually think Canada would benefit from, and there are even Spain, which has one of the top 10 healthcare systems in the world, have private insurance. People pay 100 or 200 euros a month, and you can get access to either better dentists or faster wait times, like little things like that. I'm not even sure, because I have my own private insurance, so I haven't experienced being in the public. But everyone I've spoken to said the public system is great. But in the U.S., the amount I've heard for a good private healthcare insurance, the amounts are really indefensible.
I would have to agree. I mean, medical debt is still one of the leading causes for bankruptcy. How is that ethical? It's not.
It's
But
not.
if someone comes to me as a physician and they're going to ask, "Hey, can we work this up?" I will give them options. Like, in the sense of
Right.
this is step 1, step 2, step 3. If financials are concerned, that obviously has to be taken into it. I don't think it should be, because, unfortunately there's this thing called a copay, which until you reach a certain amount, depending on the insurance that you have, you have to pay maybe 20% out of pocket, then everything else is covered, X amount, maybe like
Right.
100%, as long as it's within network. And that's just, it's sick that we put people's health before, or we put money before people's health.
Right. Like, even the things you said is too complicated. Like, I think I understand most of how it works, but just the idea that people have to think about these things that are more complicated than they need to be to access proper medical care, it just leaves such a cognitive load of this, like, piece of friction in your mind to think, oh, maybe I don't need to go, or maybe I don't want to deal with it, or if they do deal with it and then they have all of these bills, well, then it adds more pressure onto their life and less likely for them to want medical or unable to get medical help in the future. And, like, speaking of bringing it back to burnout, like, physician aside, if you're putting the pressure of all these medical bills on top of someone just because they needed medical attention, like it's going to lead. It's more likely that that person can will experience burnout in their regular lives as well, because it's just the pressure of everything mounting at once. And the one thing most people don't need in this life is, you know, a heaping of debt or the inability to go and get medical assistance. And oh, it's so frustrating for me to even hear and talk to. I can't imagine what it feels like to be inside the system that you can, have positive effect and change into just through your patients, but the whole thing is a bit of a monster to try to affect real, long-standing systemic change.
That's correct. I mean,
And
it's a lot of this is government, like CMS, or government, like Medicare. They set what we can and can't do. Reimbursement goes down for a population that needs a lot of service because of the age group.
right,
Makes no sense, and that really adds to the ability to access, because there are physicians that won't take that.